There are shoulder pains you've been treating for years without relief. Not because the medication doesn't work, but because the real cause lies deep in the colon, a place you've never thought to look and that no one has ever told you about. My name is Ethan Marshall, a 60-year-old physician practicing in the United States, and I want to begin with a statement that may stop you in your tracks. Many of the pains you've been living with for years do not actually originate where you feel them. I have witnessed this again and again over more than 3 decades of medical practice. Before we go any further, if you care about health in a deeper, more practical way, one that doesn't chase surface symptoms, I invite you to subscribe to the channel, hit like, and share this video. Your support allows me to continue creating thoughtful, honest, and truly helpful content for those searching for real answers about their health. Over the years, I have met countless patients who walk into my office with the same opening line. "Doctor, I've had shoulder pain for years." They carry thick folders filled with imaging scans, prescriptions, injection histories, physical therapy records, and in some cases, even surgical reports. Yet what catches my attention is not their shoulder, but their tired eyes, discouraged tone, and an offhand remark that seems unrelated. "I always feel heavy, my appetite isn't great, and my bowel movements are very irregular." Here lies a paradox that modern medicine often overlooks. The place that hurts the most is not always where the biggest problem resides. From an early age, we are taught that pain should be treated where it appears. Shoulder pain means rubbing the shoulder, taking medication for the shoulder, injecting the shoulder. This way of thinking is convenient and quick, but extremely limited. The human body does not operate like a machine made of isolated parts. It functions more like a complex electrical network where a small malfunction at the center can trigger a cascade of problems far away. When we focus only on symptoms, we inadvertently miss the bigger picture. I often tell my patients that chronic pain is usually a late alarm. Long before it appears, the body has been quietly sending subtler signals. Persistent constipation, bloating after meals, sluggishness in the morning, shallow or unrefreshing sleep. Because these signals are not painful in the conventional sense, they are easily ignored. Only when shoulder pain shows up and clings on for years do we panic and rush to put out the fire, forgetting to look for the source of the blaze. Before moving on to deeper analysis, I want to ask you a question for reflection, and I invite you to leave your answer in the comments below. In your view, is your chronic pain A, a localized issue exactly where it hurts, or B, a signal that your body is out of balance somewhere else? This section focuses on the foundational concept known as the colonic nerve reflex, an approach that has been systematized in the fields of natural health and functional physiology by researchers such as Bernard Jensen and Norman Walker. According to this concept, the colon is not merely a mechanical organ for waste elimination, but a critical center for receiving and transmitting nerve signals throughout the body. The enteric nervous system, with its dense network of sympathetic and parasympathetic nerves, is capable of two-way communication with the central nervous system. When a specific area of the colon is chronically irritated by fecal stagnation, mucus buildup, or toxins, abnormal nerve impulses are generated continuously. These impulses do not remain localized, but are transmitted along neural reflex pathways to other body regions with corresponding functional connections. This mechanism explains how a disturbance in the gut can manifest as pain, tension, or inflammation in entirely different locations, including the musculoskeletal system. The key principle of the nerve reflex theory lies in its systemic nature. Each segment of the colon has specific neural connections to certain organs and tissue regions, forming a relatively consistent reflex map. When the colon is healthy, nerve signals are transmitted harmoniously, supporting movement, circulation, and sensation throughout the body. Conversely, when chronic irritation occurs, the brain tends to interpret these disordered signals as pain or discomfort in peripheral areas, even when no clear structural damage exists at that site. This helps explain why many cases of chronic pain show no identifiable cause on imaging or localized testing. The concept of the colonic nerve reflex thus offers a different perspective on disease. Rather than viewing each symptom as an isolated problem, the body is understood as a tightly interconnected neurophysiological network where central dysfunction can produce peripheral manifestations. In this context, the colon is seen as a pivotal point with far broader influence than commonly recognized, extending well beyond digestion to the functional state of the entire body. Within the colon's reflex map, the relationship between intestinal segments and the shoulder region stands out with particular clarity and consistency. Clinical observations indicate that the area known as the hepatic flexure of the colon, located in the upper right abdomen, has a functional neural connection to the right shoulder. When this segment becomes chronically congested due to hardened stool, mucus accumulation, or low-grade inflammation, the abnormal nerve impulses generated there tend to be transmitted along neural pathways that innervate the right shoulder. As a result, individuals may experience pain, tightness, heaviness, or restricted movement in the right shoulder without any clear anatomical damage found in the joint itself. A similar mechanism has been observed on the opposite side of the body. The splenic flexure of the colon, located in the upper left abdomen, is considered a reflex area associated with the left shoulder. Chronic irritation in this region commonly presents as persistent left shoulder pain, sometimes accompanied by radiating soreness down the arm. Even though imaging studies of the shoulder appear normal or show only minimal changes that do not match the severity of symptoms experienced. Notably, these shoulder pain patterns are often persistent, recurrent, and poorly responsive to treatments focused solely on the shoulder, because the underlying source of neural irritation remains in the colon. When these intestinal segments are relieved of stagnation through dietary adjustments and improved elimination, the intensity and frequency of shoulder pain often decrease gradually over time, even without direct intervention at the shoulder. This relationship reinforces the view that shoulder pain in many cases is not simply a mechanical or degenerative joint issue, but a peripheral expression of a deeper functional imbalance within the system. The symmetrical left-right distribution between the colon and the shoulders further indicates an organized reflex pattern rather than a random phenomenon. Correctly identifying this connection allows for a coherent explanation of why the same shoulder symptom may originate from different intestinal segments, and why a colon-focused approach in these cases follows physiological logic rather than speculative theory. When the colon remains in a prolonged state of stagnation, the consequences extend far beyond common digestive complaints and affect multiple functional systems of the body. The accumulation of old waste and mucus creates a continuously irritating environment for the intestinal lining, leading to a low-grade but persistent inflammatory state. This subtle inflammation does not produce dramatic acute symptoms, yet it is sufficient to alter how the nervous system perceives and processes bodily signals. As abnormal nerve impulses are maintained over time, the central nervous system tends to enter a state of heightened vigilance, lowering the threshold for pain perception. As a result, stimuli that would not normally be painful are experienced as discomfort, tightness, or chronic pain in musculoskeletal regions. At the same time, stagnation in the colon can affect both local and systemic circulation. The reabsorption of unnecessary metabolic byproducts from the intestinal lumen may contribute to slower blood and lymphatic flow, reducing the delivery of oxygen and nutrients to peripheral tissues. This helps explain why individuals with poor colonic function often report persistent fatigue, reduced muscular endurance, and slow recovery after exertion, despite the absence of clear pathology on standard medical tests. In addition, prolonged imbalance in the gut environment may influence the neuroendocrine axis, indirectly affecting sleep quality and mental state. Light, easily disrupted sleep, or a lack of restorative rest is common, and these disturbances themselves further intensify pain perception and daily discomfort. In this context, treatments that focus solely on individual symptoms, such as painkillers, muscle relaxants, or mechanical joint interventions, tend to provide only short-term relief. The deeper source of neural irritation and low-grade inflammation remains, allowing the cycle of dysfunction to persist. This perspective highlights that a congested colon is not merely a localized digestive issue, but a system-wide factor capable of undermining the body's overall balance. When its role is not properly recognized, the colon becomes a silent yet persistent source of irritation, contributing to a range of chronic symptoms that symptom-focused medicine alone struggles to resolve. From the analysis above, a systemic conclusion emerges. The human body does not function according to a fragmented logic in which each symptom corresponds to an isolated body part, but rather as an integrated whole linking the nervous, digestive, circulatory, and musculoskeletal systems. Within this whole, the colon plays a far more central role than traditionally assumed, not only because of its eliminative function, but also due to its profound influence on neural state and overall physiological balance. When the colon is neglected or regarded merely as a secondary organ, the disturbances arising from it can quietly spread, manifesting as symptoms in distant locations and leading diagnosis and treatment into a dead end if attention remains fixed solely on the most obvious complaint. Therefore, focusing exclusively on the site of pain is no longer adequate in light of modern understanding of functional interconnections between systems. A more comprehensive approach requires returning to the body's key regulatory centers, among which the gut holds particular importance. When colonic function improves, low-grade inflammation diminishes, nerve signaling stabilizes, and the body's self-regulatory mechanisms are better able to operate effectively. This does not mean dismissing localized interventions, but rather recognizing that they are most effective when integrated into a broader strategy that identifies and addresses root causes simultaneously. The central message of this perspective is a shift from symptom-based treatment to system-level balance restoration. Instead of asking, "Where does it hurt?" the more appropriate questions become, "Where does the imbalance originate?" and which central system has been under prolonged strain. When the colon is restored to its proper place within the overall health framework, healing is no longer a series of fragmented reactions to symptoms, but a directed process grounded in an understanding of the body's interconnected and self-regulating nature. The content presented illustrates a consistent, system-based view of the human body. Symptoms do not exist in isolation, but arise from deep interconnections among bodily systems. Chronic shoulder pain, in many cases, is not simply a joint or muscle problem, but a peripheral manifestation of functional disturbance originating in the colon. Through the concept of neural reflex pathways, the colon is understood as a center of broad influence where prolonged stagnation can generate neural irritation, low-grade inflammation, and pain in distant regions. When treatment focuses only on surface symptoms, underlying causes remain, allowing conditions to recur and persist. Conversely, when the colon and gut function are properly positioned within the overall health picture, the body gains the opportunity to restore balance, gradually reduce chronic symptoms, and improve quality of life in a sustainable way. The lesson drawn is that healthcare cannot rely solely on treating the painful spot, but must adopt a systems-based mindset that respects the interconnectedness of organs. Practically, this means paying closer attention to early signs of digestive imbalance and maintaining dietary and lifestyle habits that support colonic function, rather than waiting until chronic pain forces a reactive response. In your view, when the body produces persistent pain, should we prioritize managing the symptom or investigating the deeper internal cause? If you would like access to more practical knowledge about health and healing, please fill out the form in the description to receive a complimentary ebook, and be sure to subscribe to the channel, hit like, and share the video to support the continued creation of thoughtful, high-value content.